I would like to welcome everyone to the annual American Club Loss Prevention Partnership Seminar, this year being done virtually. The subject of our event today is COVID-19, and our moderator for today will be Boriana Farrar. I put up on the screen some frequently asked questions. Attendee microphones and cameras are disabled until the Q&A session at the end of the webinar, at which time we'll turn everything on and everyone can ask questions. But you can ask questions throughout the event by using the Q&A at the bottom of the screen. PDF copy of this webinar's presentations and accompanying materials will be sent as a follow-up, along with a brief questionnaire, which we would like you to complete. And today's webinar is being recorded, and it will be made available on the club's YouTube channel. Please allow a couple of days for that to happen. And now I'd like to introduce our moderator for today. This is Boriana Farrar, Vice President and Senior Claims Executive, and the Business Development Director for the Americas. For Shipowner's Claims Bureau, the manager for the American P&I Club. Boriana?
Good morning, everyone. Thank you for attending our first virtual loss prevention seminar. And thank you for participating in the this initiative of the American Club. American Club is more than 100 years old. We actually celebrated our centennial a few years ago. So we offer an expertise of more of 100 years. We have offices all over the world, including London, Piraeus, Shanghai, Hong Kong, and importantly, Houston. And we're the only club in the Americas with offices both in New York and Houston. We have expertise in more than 16 languages. Our staff on underwriting claims and loss prevention includes practicing attorneys, surveyors, ship captains, and we are spread all over the globe and provide 24/7 service. I would like to thank today our esteemed speakers for the roundtable on the hot topic, COVID. We have Captain Tama, who is Commander of Sector in New York and Captain of the Port of United States Coast Guard. Hello, Captain Tama. We have Dr. Arthur Diskin, who is the Global Medical Director of Future Care and also an emergency room doctor in Miami. So he's in the trenches providing healthcare to COVID patients as we speak. We have our Dr. Bill Moore, who is the Senior Vice President and Global Head of our Loss Prevention. And we have our Jack O'Kane, who is the Managing Director of our Houston office, and we're very proud to have him today. And of course, our Richard Swan, who just you saw earlier. With that, I would give the floor first to Captain Tama, who will tell us war stories about his sector in New York, New Jersey, which was hardest hit during the pandemic. And they were the first warriors, I'll use that word as it's very popular now during the pandemic. Captain Tama, please.
All right, thank you so much, Boriana, and thank you to the American Club for hosting this important dialogue with so many to try to capture some of our lessons learned from COVID, because as we all know, we're certainly not out of the woods yet, and it's an honor to share the virtual stage with the other panelists, and I really appreciate the invitation and the opportunity. I'm going to go ahead and share my screen here. Let's see if we can make the technology work.
I have it backed up, Captain Tama, unless you need to. I can. Okay. There you go.
All right. And let's get the presentation rolling here. Okay. All right. There we go. So, and I hope everybody can see me and hear me still. All right. Great. So, yeah, what I'd like to do is just take a few minutes and talk about what we went through here in New York in the springtime. And, you know, I'm going to talk a little bit about how we framed this problem from the Coast Guard perspective, kind of what tools we employed, what partnerships were important to us. And yeah, we'll share a few stories without going into great detail. We could talk for hours and hours and hours about some of the some of the challenging gyrations that we went through. But I'll give you a snapshot and look forward to some of the Q&A from the group today. So, I'm going to start with this slide. We call ourselves Liberty's Maritime Guardians at Coast Guard Sector New York. And our guiding principles are the ones you see on the screen. Those are the guiding principles for our command. We operate with an own it culture here, own the mission, work together, no toxic behavior, invest in our future, and take care of one another. And we have a strategic plan here at Sector New York. And you may be saying, well, why is he sharing his command guiding principles and the strategic plan? That's the framework for how we approach everything that we do here at Sector New York. And what I would say is, COVID-19 was a huge new challenge for us. And so while it was a new challenge and something different for us to deal with, the operational foundation, the guiding principles that we use to deal with problems did not fundamentally change for COVID. And I think overall, the Coast Guard, and I would argue the maritime industry in general, from my perspective, was, with some exceptions, reasonably well prepared in some respects from this. And I'll qualify that as I go forward with this presentation. And so I'm going to present in the framework of this strategic plan so you can think about, how we approach these issues. Our first strategic priority is about partnerships and fully synergizing partnerships and relationships. Next is leading on emerging challenges, empowering our workforce, and taking care of our people. So I'll talk about each of those elements as we go through this. So let's talk about teamwork and partnerships. And I can't emphasize how important this is, not only for the Coast Guard, but for the maritime industry in general. And I thank the American Club for providing forums like this where we can exercise our important partnerships, because we learn so much and build relationships through these forums. We activated our crisis management team when things started getting really bad here in New York in early March. And we began regular convening and virtual gatherings with maritime stakeholders. And we did that through existing bodies like our Area Maritime Security Committee, which was created in the wake of 9/11 under the Maritime Transportation Security Act. And you may say, well, why are you using that body for a global pandemic? It was the perfect body to use for the global pandemic. The second, and I'll talk a little bit more about that, we also used what's called our Maritime Transportation System Recovery Unit. And that's a mouthful. It's a horrible acronym that's pronounced MITSRU. But you would use these after a hurricane. The last time we had a big exercise of the MITSRU here was during Superstorm Sandy. Sandy comes through, decimates the waterway and the port. That MITSRU gets together to restore that marine transportation system. And it's a way to get maritime stakeholders together and prioritize who needs to get in first, which tanker needs to get in, what container ship needs to get in, what passenger vessel needs to get in, and understand what impacts are, to assess impacts to the port, and evaluate what steps need to be taken going forward. So we convene both of those bodies on a regular basis. And I would say at the height of our of COVID in March and April and into May, when we were having weekly MITSRU calls, we probably had 200 people on the phone call. This was a 200-person conference call with port stakeholders across the port, government and private sector, state, local, federal, sharing information on challenges and sharing information on stresses in the marine transportation system. Because I think, as you all know, there aren't a lot of positives in COVID, but I would say perhaps one positive for the maritime industry is the general public, not only here in New York City, but around the world, probably has greater appreciation and awareness of the global supply chain and its criticality for this region, whether it's for medical supplies, for food, for toilet paper, for fuel, you name it. And so the marine transportation industry really stepped up. And when you talk about essential services and essential business, I put maritime at the very top of that list. A couple pictures just to show some of the challenges here. This picture that you see on the slide, there was a massive excess of supply in fuel, as you may or may not know, in the spring. Demand fell off a cliff. imagine airline travel dropping by 80 to 90%. The ferries and passenger vessels here in New York Harbor dropped by 90% in terms of capacity. Container ship, tugs and barges, less of a drop because they're carrying essential cargoes, but those numbers dropped by 25 to 30%. Gasoline demand went down by upwards of 50%. Jet fuel, of course, as we talked about. Diesel demand dropped by probably about 30%, a little bit less, which makes sense because of essential commerce and cargoes. There still were trucks on the road and ships moving, but 2/3 of the fuel supply in this region comes by water. So you shut off that demand, and you have a glutton supply. Every tank farm in New York, New Jersey, and the entire Northeast were literally filled to the rims. There were tank farms in Maine, New Hampshire, Massachusetts that probably had tanks that hadn't been used in years, that oil traders were buying up space to try to put excess capacity. And when all those tanks were filled, where else was there left to go but out at Anchorage? And so this picture that you see here is an aerial photo out at Ambrose Anchorage. And I can't see the precise date on it, but it was springtime. And we had triple the capacity that we normally have at Ambrose Anchorage. We had north of 20 vessels, 20 to 25 vessels out there for a number of days, predominantly tankers with no place to go to offload their cargo. Gas, jet, diesel, crude, you name it. Talk about a new risk that needs to be managed. And you even saw ships out there that you never see at anchor because time's money and they're always moving. And those were container ships. Even car carriers as well were anchored out at Ambrose Anchorage for days and days. And some of you probably saw this in the news out in LALB, where it's right there for the world to see. We had the same phenomenon playing out at Ambrose Anchorage. So I just share that as a snapshot on some of the impacts and one of the many things that we talked about with our existing partners. So let's talk about COVID itself and when this challenge popped up. We're fortunate to have existing relationships with CDC, Customs and Border Protections, and others to deal with some of the challenges that we face. And I got a couple lessons learned that I'll share, but let me tell you a couple stories, and I won't go in great detail in the interest of time. That cruise ship that you see in the photo is the Anthem of the Seas, a Royal Caribbean cruise ship that docks at Port Liberty Cruise Terminal in Bayonne, New Jersey on regular service out of New York during normal pre-COVID times.
All right, Captain, I hate to interrupt you.
Left New Jersey on approximately January 27th of 2020. And if I was in a room, I would ask, does anyone remember what happened during at the end of January of that year that the White House did? And somebody would raise their hand and say, hey, didn't we, that's when the China travel ban was implemented by the White House. That's correct. It was either the 30th or the 31st. The White House proclamation came out banning travel to China. If you had been in China in the past 14 days, you could not enter the United States. Anthem of the Seas left a few days before that. And lo and behold, a number of Chinese nationals were on board the Anthem of the Seas. They had already made entry into the United States. They were inside that 14-day window, and they embarked on a 10-day cruise on the Anthem of the Seas.
Captain,
so
we hate to...
way back, bound to return to Bayonne from the Caribbean on or about February 6th or February 7th, inside that 14-day window. Now, policy gave us exceptions to say, hey, if you're already in the United States, we have a way to get you home. In this case, though, a number of those Chinese nationals were exhibiting flu-like symptoms, fever. There was family and a travel group together. The cruise ship quarantined these individuals in their cabins, but they had no ability to test and determine whether they had COVID or not. So this was the call that we got by the Coast Guard. The ship notified us, and we immediately got our partners together and tried to come up with the right solution on how to deal with this. And this was really the first cruise ship arrival in the United States with potential COVID cases on board. Was this case in early February here in New York. And you can imagine the level of concern.
Captain
5,000 passengers on this, bringing potential COVID patients into New York and New Jersey. But keep in mind, this is early February. This is well before things got really bad. I'll just tell you, in the interest of time, you know, the captain of the port, I'm entrusted with the authority to deny a ship entry. It's a big decision to say a cruise ship with 5,000 passengers on board, predominantly Americans, cannot come into the port. So we had to work this decision through an escalatory decision-making process that ended up at the very highest levels of the U.S. government. And we ultimately got the ship in, got the people off, got them tested, and the test results were negative. But this was really a precursor to what you saw play out in the cruise industry over the weeks and months after that, where we ended up with thousands and thousands of passengers that we had to get back into the United States and offload. So I just give you that as an example. And there were a number of other cruise ship stories out there. Mid-March, things got really bad. The New York City declared emergency, New York State declared an emergency, federal government declared an emergency. And about March 15th, CLIA, Cruise Lines International Association, voluntarily paused all cruise ships. We had multiple cruise ships that we had to get back into New York and get those passengers offloaded safely in a very difficult COVID environment. We also saw cargo ships with challenges. The Coast Guard treats COVID as a hazardous condition that has to be reported to the Coast Guard. And I'll tell you this, we talk about transparency as being fundamental to risk management. Those ships and companies that had a good safety management system in place before COVID were the best operators to deal with during COVID, because they had a safety culture, they were transparent, they reported things to the Coast Guard. And I'll say we saw full spectrum. Those that reported, those that did not report and should have reported, and unfortunately put individuals at risk and jammed up the marine transportation system. And we have a number of examples on that front. And keep in mind, even if the Coast Guard says or CDC says it's okay for a ship to come on board into the port, put yourself in the shoes of the Sandy Hook pilots or somebody else who's going to be the first person to set foot on that vessel. And we had to work through a lot of those risk management decisions. And there were vessels up, pilots associations in New England, when you remember when 700-800 people a day were dying here in New York. And think of those New England ports that get fuel from the port of New York and New Jersey. And there were pilots associations in New England that said, we don't want to set foot on this ITB or ATB that's coming into Port X in Maine or New Hampshire until a 14-day quarantine period has elapsed. And those impacts on the supply chain for fuel. So those are some of the areas that we worked through. And, you know, I don't want to go over much time. I'm coming up on the end of my allotted time here. But I'll say we were also heavily involved in the USNS Comfort mission, bringing that in, as everybody remembers. And we were very proud to be involved in that. And that was a team effort. Emergency dredging at the cruise ship terminal. The Army Corps of Engineers just did heroes work for that. We were proud to be part of that effort. But I'll say the challenges that you all had with your workforce, we had the same with ours. And we could not stop doing the mission. We had to keep commerce coming in. We had to keep the port secure. And we figured it out on the fly by really establishing expectations of outcomes for our people, keep getting the mission done, but giving them the flexibility to figure out how to do it in new and creative ways. Because for instance, if we don't do the inspection on the tanker that's coming in, they can't offload that vital cargo. So we had to get that mission done. And our folks didn't miss a beat. And I'm very proud of that. While at the height of the COVID pandemic here, we were out in full PPE, continuing to get important missions done. And then lastly, I'll just say, you know, we're a Coast Guard family here, and we come and are assigned to New York, and we bring our families. And so our families don't have the support networks that other communities that are sort of native, if you will, to New York have. And that was a real challenge for us, taking care of our families. And I think COVID, as you all know, is a risk that transcends both work and home. It's not normal that, you know, the risks we face on the job at work, or doing a boarding offshore, a counter drug case, a stowaway, or whatever, we typically don't bring those risks home. There was a threat of bringing that risk home to our families, and that was something we really had to work through here, and was actually a critical part of our crisis management here, was taking care of the community as well. So that's a little bit of a snapshot of some of the challenges we dealt with here in New York. And I think I've used up my 15 minutes, but I look forward to hearing from the other panelists, and I look forward to the to Q&A, and happy to go deeper on any of these topics or lessons learned on this front. And I look forward to the rich discussion. So thank you all very much. I will stop sharing my screen and go back on mute. Thank you. Back to you, Boriana.
Thank you very much, Captain Tama. And just for everybody, this was extremely informative and interesting. For everybody's reference, Captain Tama has full slides, which for some reason did not show up on our screen, but they're available and will be distributed after the presentation. So I would like to give the floor to Dr. Diskin. Dr. Diskin, please.
Good morning. Let me see if my slides work a little bit better to share here. Hopefully everyone can see these.
Yes.
Okay, so. Okay, so good morning. That was a very interesting perspective. What I'm going to try to do is give a little bit of the medical perspective of COVID here and where we're at this point. So my background is emergency and critical care medicine. I've been chairman of multiple emergency departments in the South Florida area, and I was sort of part-time medical director for Carnival Cruise Lines for many years. And then in 2008 through 2016, I was recruited to be the global chief medical officer for Royal Caribbean Cruise Line. So I have many years of experience with maritime from the cruise line perspective. In 2016, I left Royal. I returned to teaching at the University of Miami Jackson Memorial, doing a lot of risk management, expert witness, consulting work in emergency medicine. And now I'm also the global chief medical officer for Future Care, which services about 70,000 or more crew with call centers all around the world to manage case management and crew medical problems in the maritime industry. So that's keeping me quite active as well, and is the hat I'm wearing today. So where are we? This is as of about a week ago. The numbers are increasing precipitously around the world. We really are so self-absorbed in our situation here in the United States that we don't always appreciate what's happening in other locations. But we're well over 1 million deaths and 34 million cases. And the numbers are running fairly consistently. About 20% of the deaths and cases around the world are in the US, although I have a feeling that the numbers from other countries are underreported, and that the death rates are probably significantly underreported. But what we are seeing in the US, and I think this is important to our behaviors in this time of COVID, is we're seeing a dropping case fatality rate. And there's many reasons for that. When this first came out, it looked like the mortality rate may be around 4 or 5%. It was even higher in places like Italy for a whole host of reasons, including the demographics of who was getting sick. But with more tests being done, that basically is raising the denominator of the equation, while the numerator, the number of deaths, is remaining the same. And I think that we're also seeing better isolation of at-risk individuals and vulnerable populations. So nursing home patients are being better protected. Elderly relatives are isolating and not mingling. Weddings are postponed. Group activities are postponed. So we're also seeing a decrease for that same reason, these super spreader events, which are very significant. We had that one very heavily reported wedding in Maine where something like 70 plus people got sick, and a number of people, both attendees and contacts of attendees, died subsequent to the wedding. So these super spreader events certainly have been an issue. And to some degree, I think we've seen a decrease in those, although there's this tremendous pressure to reopen. We also, in the beginning, were intubating everybody and putting everyone on a ventilator because we thought that that was appropriate, number one. Number two, we thought that the virus would be spread to all the healthcare providers if we didn't create a closed loop, and that's what intubation ventilation does. We since have developed a number of alternative ways to manage the low oxygenation or the hypoxemia, which is really the number one problem of COVID that kills people, is the inability to get oxygen into the bloodstream. we certainly have a much better recognition of treatment and complications. The availability of medications at appropriate stages of the illness, antivirals, anti-inflammatories, plasma from recuperating individuals, and now monoclonal antibodies, which you probably saw that Trump got when he was admitted to the hospital, are all significant advances in the way we use the medications. And the demographics, of course, will always be based upon the death rate, will always be based upon the demographics. So in Italy, for example, we had a number of elderly individuals living in the area that got very hit hard, and it affected the ultimate fatality rate there. And the reason I bring these slides up in general is that the lower the case fatality rate, the more the pressure is to open up society to normal activities, which will increase the rate of illness, but not necessarily, again, the case fatality rate. So that's something that we watch closely. Now, what are the specific viral challenges to this? It's very easily transmissible by what they call a droplet, which means that within a 6-foot range, more if somebody is coughing or sneezing, the virus is expelled on droplets and can be inhaled by somebody else, or it can land on a surface where someone can touch that surface and then put their hand in their mouth, their eyes, and contract the illness. Now, people have been debating the impact of aerosolized transmission for months now. The CDC's gone backwards and forwards. You know, the response is certainly it can be impacted by aerosolized transmission. It depends really what you're talking about. Is it going to be in air conditioning ducts and go down 3 or 4 stories or 3 or 4 decks on a ship? You know, probably not. If you're in a room with someone who is coughing, sneezing, singing, karaoke, yelling, and there's a virus that gets into the air, and you're exposed to that and you're there for a period of time, you certainly can get ill even if you're more than 6 feet away. So it's all a matter of what is the viral load you're getting exposed to. The survival on surfaces has been a keenly debated item, and all of the studies that were done were depositing large amounts of viruses on the surface and then testing them up to 3-4 days later and saying, wow, there's still some viral particles on there. What they didn't test is whether or not those viral particles were transmissible, whether they would cause illness. And the truth is when somebody coughs or sneezes and it drops onto a surface, they're not depositing millions and millions of viral particles on there. But what we do know is that there is a spectrum of survivability, ranging from a very short period of time on copper, which is known to have antiviral properties, to other surfaces such as steel and plastic. And one of the results of this COVID infection is we may actually see the increased use of copper alloys and high-touch surfaces on not only on ships, but shoreside. So certainly on, even when I was at Royal Caribbean, we were debating whether or not to make all of the handrails on the ship copper alloy, whether to make the elevator buttons copper alloy. It was cost prohibitive at the time, but probably not so now. Now, the virus is easy to kill with hand washing and 70+% alcohol because it has an envelope. Something like norovirus was always a major problem for us because it had no envelope, and the hand sanitizers really don't work on norovirus. They may make you feel better that you're doing something, but they're not particularly effective because alcohol destroys the envelope of a virus. So that makes COVID is very easy to kill with hand washing and very easy to kill with alcohol. And it's easy to kill on surfaces with a number of different solutions. I personally prefer chlorine-based products versus quaternary ammonium compounds just because they are much more effective against COVID. And then the other concept that becomes important is that with any process, you have to have cleaning versus sanitation. So no surface can be sanitized until it's first cleaned. And this becomes even one step further because there are a number of products that are being introduced now that are claiming to have prolonged activity of a week, 2 weeks, depending upon the friction on the surface. Some of them natural, some of them chemicals, and they need to be applied to a cleaned surface. The incubation period, we've watched this go back and forth over a period of time. We're now pretty much settled on sort of 4 to 8 days, generally around 5. 97% have the illness by 11 days. I think that's important because I think right now everybody's always been talking about a quarantining period of 14 days. That's the period we use on the ships to recommend how long to be quarantined. I think that's going to ultimately drop and probably should drop really to around 10 days. Certainly by 10 days, if I was exposed, I would certainly feel comfortable going back out in public. And the key thing here has been asymptomatic transmission, because you get the highest viral load just before and after symptoms. So this is the Achilles heel of the virus for us, is that transmission can occur in people who are either pre-symptomatic and will eventually develop symptoms, or completely asymptomatic and never ever get symptoms. The other thing that's very unusual about this virus is this unexplained rapid deterioration in certain patients up to around 10 days. And I think that even with Trump, if you're following it, part of the concern is, you know, at what point is he out of the woods of developing this sudden deterioration? And this deterioration seems to be more of the body's response than the actual effect of the virus itself. So the first phase is all the symptoms you get are due to the virus, and then the second phase is this massive inflammatory response, which is what ultimately kills the patients. And this is an extremely complex virus once it gets into that phase with the pathophysiology of the critically ill patients. And the other thing that is becoming apparent is that one of the things that's been talked about is, do you still have immunity once you can't measure antibodies in the blood? And I think the thing that we need to remember is the body has multiple layers of immunity, including what's called T cell and B cell immunity, in addition to the direct antibody levels. So there's still so much information we're going to need to learn is, once you become ill, are you immune, and how long are you immune for? Now, what are the challenges for the ship owners that this creates is keeping the virus off the ship that have not yet experienced illness, sort of creating a pristine ship. And then the crew screening prior to boarding. And what do we use for that? You know, testing and temperature. So initially, everybody made a big deal out of temperature, but only about 40% of people who either are asymptomatic or minimally symptomatic have an elevated temperature. So while ultimately everybody who gets clinically ill gets a temperature, it's not the best screening tool. Now, proper cleaning and sanitation during and between voyages. Where do you clean? How much do you clean? What do you use to sanitize? Maintaining social distancing on board is certainly a challenge, especially while trying to avoid the psychological effects of isolation. And preventing asymptomatic transmission. Proper use and establishment of a culture on board the ships for hand washing and face mask use. You know, this is a new world. And whenever you're in public and you should be wearing a face mask. Management of contractors, vendors, and governmental authorities who like to come on board the ship when the ship is in port. And you do all this work to keep your crew pristine, and some asymptomatic transmitter who doesn't want to wear a mask comes on board the ship and contaminates the ship. You know, how do you avoid that? And then what testing strategies? And whatever you do for testing, we'll talk about, is obsolete a day or two later because something new is coming up. Safe management of cargo and supplies. Originally, we thought that might be an issue. There really have been no reported cases of anybody becoming sick from the handling of cargo and supplies. And certainly wearing work gloves while you're loading the cargo and having it sit out in the sun. There's probably minimal to no risk of contracting COVID from loading up and unloading a ship. And then what do you do with a sick crew member? You know, the difference between and then everybody else is quarantined. So terminology wise, we should be careful that we differentiate between the terms isolation and quarantine. And then how do you manage somebody who becomes critically ill on board the ship? And how do you manage an emergency disembarkation to a port that doesn't want to take even somebody for a toothache, let alone somebody who is emergently ill? And then assessing medical care and or repatriation of crew with other conditions. You know, whatever crew members get, whether it's psychological, whether it's physical, whether it's surgical, they still need to be managed effectively and sometimes be gotten off the ship. So just a touch about the virus. In that you have all of these surface proteins, and this becomes important for the development of vaccines, because you develop the vaccines to these surface antigens, so the body will recognize them and fight them. So that's sort of all the techniques revolve around that. Some of them are, and the question is, how do you do that? The antibodies that Trump got are not a vaccine, but they're direct antibodies to these surface antigens. They're isolated and broken up to surface antigens. They're injected into, let's say, a cow. The cow develops antibodies. The antibodies are purified, and then they're used for humans who either are exposed, step one, have early clinical illness to prevent them from getting worse, such as in Trump's case, or used to treat critically ill patients. So these surface proteins become important for developing the vaccine, they become important for developing the antibodies, and they become important for the testing. For instance, the original Abbott that came out that was supposedly a rapid test required a reagent to break down the virus because it was measuring it was creating, the antigen was in the nucleus, right? The newer Abbott and all the things they're trying to create now to measure are to the surface antigens, which creates less sensitivity, maybe some questions with specificity, but is much easier to do because you don't need reagents. All of these are injectable. The one that got the most publicity is Moderna because they have a new methodology using messenger RNA, which means that they sort of train the body to make its own vaccine against it. A little complicated. And then Vaxart is the only one that's creating an oral vaccine, which they're only in phase 1 studies, but if they manage to pull that off, logistically, an oral vaccine would be tremendous. So in the interest of time, we'll go through this quickly. PCR is the gold standard here for what we use. It's very sensitive. It remains positive even when the crew member may already be clinically well and not communicable, not transmissible. And that's been one of the problems in trying to use it to determine whether somebody should go back to work as well as when somebody is sick. Now for antigen testing, again, it's the nucleus versus the surface. And the controversy here is, do we really need a nasopharyngeal swab where we're injecting it, where we're putting the swab all the way into the back of somebody's throat? Or do we, can we just use saliva? Can we use an anterior nasal swab? And then the immunoassays, we got a bunch of terrible quality immunoassays from China, sort of a secondary insult. But these really, in clinical practice, have a very limited applicability. So what's next? The next is we're going to move from this. The highest priority for us has been to get the very, very accurate testing with the PCR. And that's been taking 2, 3, 4 days or a week to get the results back on that. And the way we're moving now is to develop a frequent, lower cost, faster turnaround, less sensitive test and accept that, because what we're really going to look at is testing whether or not the person is contagious. And we need to take a look at what is the role in crew screening and back to work post-infectious decision-making, right? So what are the challenges that we've had? We've had significant shortages of the reagents, which are the essential chemicals to use in the diagnostic testing, and that's been hampering this turnaround in the US. And you'll find that certain hospitals, mine included, actually have obtained machines to do the PCR testing in several different ways. Abbott also has had difficulty keeping up with even their rapid tests because of keeping up with the amount of reagent. That's been the limiting factor. That's why the development of tests that don't require reagent, even while checking for some or accepting decreased sensitivity, become important. So just to give you an idea of what's out there is that, there's something called COVID nudge, and that's a point of care test, 94% sensitivity, which is pretty good. And the swab from wherever it's taken, the nose, the throat, the mouth, is loaded directly into a cartridge. The cartridge is loaded into the machine, and then you have your answer about 15 minutes later. So the problem you have is you still need a machine and you still need a cartridge because the methodology of the testing. So you're not going to really transition this to a home yet, but you may transition this to a situation where you can deploy it, let's say, to a cruise port. You can deploy it to maybe even a concert venue and get rapid tests back. So this is where our goal is. This is what you need to look and watch to see. Maybe we're 3 months away, maybe we're 6 months away, but is this paper antigen type of test, which is almost like a home pregnancy test or something. You just take a nasal swab or saliva, you take a swab of paper, you put it into a tube, into the reagent, and it changes color. So the low cost, the goal is to have low cost, the goal is to have rapid in less than 15 minutes, and the goal is to be able to do it at home. And then you get this mass production, and then perhaps you do it every third day to sort of see, keep your work population free of disease, whether you do it on a cargo ship, or whether you do it on a cruise ship. And then the sensitivity becomes enough to detect the majority of COVID. Because what you're looking at here is that this is the sensitivity of a PCR test, and this may be the sensitivity of a rapid swab test. So this area is where you may miss the clinical illness coming out of it or going into the disease. And then over here, you know, because you're going to continue to be positive with a PCR all the way out to 3, 4, 5 weeks after illness, but you're not contagious anymore. So if you use the swab again to say, okay, when am I no longer contagious, you can get people back to work effectively with a test in this period of time. So that's going to become very important. Now, everything that we do here is basically trying to get to zero risk. And if you remember your high school math, you never get that asymptotic 9 never gets to 0. So we're never going to create zero risk. So over here you have wearing a mask, social distancing, hand washing, regular testing. So the more we do to try to avoid illness, the greater the expense, both direct and in cost to our daily lifestyle, but we never get to zero risk here. So what are suggestions? We need general hygiene guidance for crew pre-deployment on board. I suggest one person on board every ship. If you have a number of people in the company that have medical certificates or more medical experience, disperse them amongst the entire fleet. Universal use of face masks on board until a cohort of crews together for 10 days or so. Social distancing during meals and other non-work activities where people are wearing masks. Increased deployment of hand sanitizers. Gloves while moving cargo just to be safe. Mask and glove removal and putting them on properly. And then at every stage of the trip where these ships are, they should be taking a look ahead of their itinerary. They should understand what the incidence of COVID is in that next port and what their options would be both for testing and for symptomatic crew members and for crew with other medical problems. What are my options at Hong Kong? What are my options at Barcelona? Wherever that ship is heading, what are they going to possibly do? And if it's a small enough ship, one of the things that might be very effective is to just turn over the entire crew when possible at the same time. You have to manage the people who are coming on board. You have to clean and sanitize between voyages and disembark staterooms. Identify potential isolation cabins on your ship. Make sure your PPE levels are adequate on board for any contingencies. And then you really need to think about what you want to do with your crew, your officers. Many of the officers may be over 60. They may be immunocompromised or underlying medical conditions. What type of voyages do you want to send them out on? Where should they be deployed so they have access to medical care? How do you decrease their risk? And how do you keep them well while they're on board? This year, more than any other year, I would recommend 100% mandatory flu vaccination to all crew on any ship anywhere, because the combination of flu and COVID is deadly. And if somebody gets a respiratory illness, and you don't want to completely stop your operations when it's flu. So while it's not 100% effective, it's fairly effective every year, and you want to mandate that for your crew. One of the things you can do is you can maybe take a ship and cohort those crew who have already had COVID and put them on one ship. And you may want to use somebody who's been previously ill for necessary port activities, because I really don't think we've seen very much. We've only had one validated case of reinfection, and I'm not even sure of that one. Of course, it's early. You may be able to get reinfected a year, 2 years out. Continuous updates on the status of every port visited. We talked about that. Integrity of your pre-boarding testing program. Obviously, if you test somebody at home 72 hours before they come, you need to think whether or not you want to do additional testing when they arrive at the port or at the ship. And then you want to maintain a very close working relationship with your telemedicine provider to keep you updated. Management of suspected crew is really to manage them ahead of time. I'm running out of time here. So this basically manage your sick crew member before they get sick. So flu vaccine, PPE, know where you're going to isolate them, know the difference between isolation and quarantine, know who's been previously ill to create a barrier around them with someone who's recuperated, dedicated medical provider, know what you're going to do with them the next port, make arrangements for testing, and make sure you can identify quickly which of the crew are getting sick. Vaccine development, I think we will skip the development, but what I do want to talk about, because I think it becomes important, is that everybody will not have access to the vaccine when it comes out. And this definitely needs to be considered for crew on board ships. And then the first group that will be vaccinated will be healthcare workers. My best guess is that would be sometime in the first quarter of 2021, assuming that none of these vaccines and later trials turn out to have significant side effects. We've already seen one trial that had to be stopped for a short period of time due to the development of one person of transverse myelitis. So the healthcare workers will be first. The second will be highest risk, which is high risk underlying conditions, nursing home patients. And then here's number 3 is these essential workers. And this what becomes important is that the maritime industry needs to do as much as they can to make sure that these workers are considered to be essential workers, because now you'll go down to at least, or rise up to at least a third group of people to get your crew vaccinated. Fourth group will be young adults and children, and then essential service workers. And then the last group will basically be everybody else. So, and we'll go ahead and stop here at this point.
Thank you very much, Dr. Diskin. You already have 2 questions from our audience, which we'll address at the end. Very interesting presentation. It seems that now we're going to, it's my turn, and we're going to discuss some P&I implications on illness claims, COVID illness related claims, and my colleague Bill Moore is kind enough to change my slide. Thank you. Bill, first slide. So our crew members who fall ill to COVID covered under our rules, and I have to underline the American Club is part of the international group. So in a majority, same rules apply for the P&I world as well. So the answer is that there is no specific exclusion for a P&I cover for COVID-related claims, and a crew member who falls ill or dies due to COVID during the period of his employment would be treated in the same way in case of any other illness or death claim. Next slide, please. If a crew member contracts COVID during his trip to and from the vessel, would such claim fall under the member's P&I cover? The short answer is that most likely, yes. And again, if the member is traveling to and from the vessel and he's still within the scope of his employment or employment contract, then P&I cover will respond in the usual way. Next slide, please. Now, are diversion expenses covered for a crew member or passenger who has fallen ill due to COVID-19? And as with any illness requiring the vessel to divert, such expenses would fall under the crew club rules that I've quoted for you for your ready reference. And cover in this particular case would be limited to additional costs listed in the rule. And for example, such additional costs would be bunkers, insurance, stores, provisions, additional wages that might arise as a result of the diversion. And here I want to open a bracket that diversion is distinguishable from deviation, where the vessel diverts its course due to an illness on board the vessel, and any expenses in conjunction with that diversion in relation to the illness claims would be covered, as opposed to a deviation where the vessel is intentionally diverted for any other purpose where expenses may not be covered. Next slide, please. So what costs are covered under the club's quarantine expenses rule? And that's $1 million question, right? So if there is an outbreak of the disease on board the vessel, the member will be covered for extraordinary expenses as a result of the outbreaks. And those costs are consequent as to the quarantine, and those costs are enumerated in the quarantine rules. Here it's important to underline a distinction. If the vessel is quarantined as a result of a government order, then more likely than not, the majority of the expenses that arise as a result of such quarantines would be covered. But if the quarantine is purely precautionary, it's considered an operational expense, and any expenses that would arise in the regular course of business that are not extraordinary, more likely than not, would not be covered. Next slide, please. Now, I have a slide for a passenger vessel, and my colleague, the claims manager of our Houston office, Jack O'Kane, would further discuss this. But just to summarize a COVID-19 outbreak on board a passenger vessel, when it relates to sick passengers or sick crew, then we have to analyze whether there is a casualty on board the vessel, and if there is an outbreak, there is a casualty. And in this particular instance, Club Bros describe what is a casualty and what will be covered or not under this scenario. Illness and repatriation, medical care expenses of any crew and passengers would be covered. Any quarantine expenses that are mandated by a port regulation or a government regulation would be covered. But any preventative quarantine expenses as described would not be covered. And importantly, if there are any operational expenses that arise in the usual course of business, notwithstanding of the casualty, such expenses would be calculated and deducted from the amount of the claim. And we have good formulas that are a lot of fun for that purpose at the club. But an example is usual port charges, wages that are usually paid to the crew, food, any other expenses, any other operational expenses would be deducted from that claim. Next slide, please. Now, we like scenarios as, especially on the claims executive side, we see certain cases, and we want to present to you how things might work in practice. So for our first scenario, we have picked the following fact pattern. We have a sick seaman who fell ill immediately after disembarking a vessel. He has high fever, he is exhibiting the usual symptoms, and 2 days later, there is a family member, his wife in particular, who also gets sick. And his wife, let's say, is a nurse, so she's in the medical profession and widely exposed to COVID patients. 2 days later, so we are 4 days in, we have a symptomatic crew member, specifically 3 of them, which are developing high fever, muscle pains, headaches, and just to make it even more interesting, one of them is diabetic. Now, I would like to pose a question to our audience as to, do you think expenses of the sick family member would be covered? And I would like you to think about that. And we're going to distribute a poll to that respect, and I'll answer this at the end. But I'll start with the sick seaman. As discussed, any expenses in conjunction with providing the best medical care for this sick seaman would undoubtedly be covered. And in this respect, we rely to third-party case managers as Future Care and others to monitor the condition of the seaman and work closely with them and the member as to make sure the seaman is quarantined, the best medical care is provided for him. Some expenses, extraordinary expenses as to delivering food and medicine might be covered in this scenario if this is necessary, and others. Other symptomatic crew members, no doubt, any expenses in conjunction with cure and repatriation of these crew members would be covered. Now, would quarantine expenses of the sick, as we explained earlier, of course, they would be covered, and as the usual P&I cover will respond. Quarantine expenses, though, that are purely preventative of the remainder of the crew, and in this case scenario, we have 2 other crew members who do not have symptoms, but they happen to be on board the vessel together with the crew, which subsequently fell sick. Those expenses, including their wages, would not be covered. But if we have to hire 2 other crew members to substitute the quarantined crew members in questions, those extraordinary expenses, more likely than not, would be covered. Now, the vessel, if we have such scenario, no doubt that the vessel has to be cleaned. And I think Dr. Diskin went in much detail as to various cleaning procedures. And that's a question we have very often from our members. Cleaning of the vessel and any expenses thereto would be covered under this claim. Next slide, please. Now, what happens if there is a member of the crew that gets sick during the voyage? What do we have to do? Well, we have a vessel, and if we have a vessel, let's say, directed to a particular port, but another port which is closer is more convenient if the seaman is not feeling well and we're losing him. In this particular case, of course, we'll work closely with the member. We will appoint the case manager, will provide the best medical care as to monitoring the condition of this crew. And as the vessel is diverted, expenses as to these extraordinary port charges and any other expenses that might arise, including repatriation of that seaman if he has to be picked up by helicopter or depending on what happens, will be covered. Now, the asymptomatic crew members that more likely than not have to be quarantined as a pure precaution, their expenses would fall within operational expenses and would not be covered. But again, if we're dealing with the country or a port or a state that requires a mandatory quarantine, then the scenario will change and expenses might have to be covered. And again, undoubtedly the cleaning of the vessel and any expenses thereto would be covered. Next slide, please. Now, what happens if the vessel, for example, is docked on board the vessel, and we've picked a scenario, an asymptomatic electrician conducts repairs as to maintenance of such vessel on board of the vessel, but gets sick the same day as he disembarks the vessel. Now, that's a very interesting scenario because it could come 2 ways. If I was still a practicing lawyer, I would draw the curtains down and I would ask a potential client what do you want it to be, right? But now at the club, we have certainly a different way of approaching things. So joke aside, if generally P&I cover responds to third-party liability claims. So if subsequently it becomes clear that in any event this electrician has been infected by a potentially sick crew, then P&I cover will respond in usual way and will be potentially covering any expenses as to illness or to those electrician. More likely than not, though, the electrician, if the crew is asymptomatic, as this is our scenario here, and they don't develop symptoms before the electrician, and the electrician is a land-based worker under a workers' compensation scheme in this particular case, then this electrician would not be covered by the P&I cover, and in this particular case, we would have a non-covered claim. Again, quarantine and cleaning of the vessel under this particular scenario, more likely than not, would be considered operational and preventative and will not be covered. But again, if there is some indication that the sickness of the electrician is caused by the crew members, and there might be some third-party liability scenario here, then the coverage scenario will change. Next slide, please. I would like to give this slide to my colleague, the claims manager of Houston, Jack O'Kane, who has extensive experience in handling such claims, and he will explain as to how they work.
Thanks, Boriana. Unfortunately, I do have a little bit of experience in this. The good thing is we've had some good outcomes here, and the experience is always welcome, even if it isn't an expensive way of getting experience. Sick passengers occur on a variety of vessels, and in looking at a COVID claim or any other claim, as Boriana pointed out, the claim is the claim. The sickness is the sickness. The response is the same under the P&I rules with the clubs. And in my scenario, we had a vessel which left a port several days into the voyage. Passenger became symptomatic, and it was brought to the attention of the captain and crew. They immediately initiated their response and sought a port of refuge, if you will, to provide the necessary care for this passenger. There was a lot of things that had to be taken into consideration. Obviously, there are some at this point in time, the cruise lines had ceased operations regionally. Ports have been closed, borders have been closed. So a lot of things had to be arranged in preparation for an arrival. Getting the passengers off who were sick and getting the necessary attention, having the assessment of all other parties on board the vessel now had to be a consideration too. And the cost of getting the necessary PPE and other things to address this was arranged through a correspondent and the port agents. So it's critical that the member, the vessel, and the parties involved engage and make the necessary arrangements to address the unfolding situation. There are, as Boriana pointed out, a variety of considerations. There's going to be additional port costs for a deviation or going to a different port. There's going to be medical teams. There's going to be now a quarantine of the vessel. So as she pointed out previously, there are anticipated costs, and then there's extraordinary costs that have to be addressed. And in our scenario, we had a number of parties who had to be quarantined aboard the vessel because the local health authorities were not going to allow anybody off the vessel as you would in any quarantine situation. Subsequently, we were able to make arrangements after the situation was stabilized. Sick parties were taken off the vessel and care was provided at various hospitals in the port city. And now the objective was to now get the passengers off of the vessel and begin a repatriation process. This was quite an undertaking. We had to locate adequate resources because of restrictions. There are resources available throughout the world, particularly, as you'll see in this situation and in this picture, a large international airliner was necessary to bring the number of passengers to their home ports, home places of residence and home countries. So this has to be adequate and it has to meet all the requirements of the health authorities to allow for them to first be transported from the ship to the airport where they can be sent home. Obviously, there are going to be a number of positive and negative passengers in this situation, so they had to be separated for their trip through what they call the humanitarian corridor, from the port to the airport, and obviously they had to be separated aboard the airplane. It's quite an expensive undertaking, but in these situations, that's what the insurance is for. We were able to get, and then in this scenario, we had several planes that were necessary, but we were able to get the passengers home where they were further quarantined upon their arrival in their home countries, and then allowed to return to their homes as under the quarantine guidelines. I guess what we should really look at now is what happened on the crew side. The crew was also affected. They were kept aboard the vessel. They weren't allowed to disembark unless they were sick and needed hospitalization. Those situations were taken care of. Not going to go into all the details there, but in essence, the quarantine had been waited out. The vessel was sanitized, and eventually, after the prescribed time, the vessel was allowed to leave the port, where it went with all the rest of the cruise lines, ships out in the world, into either a situation of warm or cold stacking, or waiting for the future to unfold to them. Beyond that, I think the key is to control and be very forthright and open and transparent. It's important that the member and those involved share information, especially with the people involved. The people that are on the vessel want to be in touch with their families, but they also want to know what's going on with themselves. So the authorities have to be forthright with them and transparent. And at the same time, we have to manage everyone's expectations and get everybody the care that they need. That can involve, hampers of comfort foods and things like that while they're in quarantine, just to maintain the communication and the condition of each of these passengers. So beyond that, we still are, in my situation, we are still working on this claim. This happened early in the pandemic, and these things don't just happen and go away. But if anybody has any questions later, I look forward to hearing.
Thank you very much, Jack. Next slide, please.
Apologies. Apologies, my mouse isn't trying. There it goes.
Perfect. Thanks, Bill.
Sorry about that.
Thank you. So if we have to summarize, and this is certainly not a complete coverage of all the issues that could be discussed today. In case of COVID illness claim, the traditional P&I cover will respond to such claims in the usual way. Quarantine expenses are covered when related to illness claims, and I want to add that if there is any gray areas, certainly any claim will be reviewed on a discretionary basis, ultimately subject to review by the board of directors. We have a preventative and proactive approach essential to minimizing exposure, and in case of a COVID-related claim or a casualty, we closely work with our members, local correspondents, and third-party case managers as a team. And we have a wide area of loss prevention resources, which our Dr. Moore will cover, but one of them, the club on our website, we recommend creating a questionnaire for crew members, and some of our members are already using similar documents in advice and deployment in order to check whether a seaman has presented symptoms of illness and prevent potential COVID spread. And this document is available on our website. With that, I want to give the floor to Dr. William Moore, and I want to note that I've seen the 2 additional questions to me and Jack, And thank you very much. Our audience is very active. We're very happy about that. And I would like to give the floor to Dr. William Moore, who's going to talk about our loss prevention resources. Bill.
Thank you, Boryana. I'll be brief before we take our Q&As. I do apologize that I'm just a moment here. I'm just trying to, I had my presentation up and ready, but seems to have disappeared here a moment ago. 2 seconds, sorry. But what I would like to start with is that since March, as we saw, actually it started in late February, we began to see, inklings of issues related to COVID in one form or another. Became more of an issue for us in March, as we started to see more cases arise, at least globally. And the matters related to COVID are not, or we've been talking a lot today, particularly from the club side, a lot about, excuse me a second here, I'm just finding my presentation. There it is, now we're up and running. And I will just, my apology. But we started to see issues arise out of not just claims with illnesses that arose, but also significant issues related to charter parties, contracts, changing of crew. I mean, there are mental health issues that, of course, come into play. We've seen a number of these matters arise during the time period. So what we wanted to do was, excuse me, there we go, and I'm switching out. Finally, I got my technology together here, apologies. So as I mentioned, there are lots of pieces to the puzzle globally. There's matters related to ships, matters related to operations, where crew changes are being made, consequential charter parties, where ships are to arrive thereafter to load or discharge cargo. There are a number of matters that arose and arise and continue to see various issues arise from a loss prevention perspective. So what we've done at the American Club beginning in March, we started to create a number of guidances, not only handling our claims and addressing our claims as Boryana and Jack have given their very good explanations on, but really looking at guidance that we could provide to ship owners, not only our own guidance, but also the most critical links that we found and that we find that are very important to the industry and to address COVID. So we have a dedicated COVID website. As you see at the top, there is a link to that particular page. Once you open the American Club's website, you will find that page, a headline in red for that page. Click on that, and all the resources that we develop on the loss prevention side are all found under that heading. Now, one of the first things that we had done, and this was just before COVID, but we saw the threat on the horizon, a number of us got together and worked on the charter parties and contract guidance you'll find on the website. We will also be providing us at the beginning of the presentation. We mentioned that we will be providing links to these documents and we'll send to you individually. I think one of the most important things that we prepared, which was a collaboration between our senior management, our senior claims management, and loss prevention, was our quick reference guide. That's very important, just quick Q&As related to matters associated with COVID on the claim sides. A lot of that was already presented in one form or another by Boryana and Jack. We put out periodic circulars and alerts as we see important issues arise related to COVID-19. We put out a bunker guidance. As you know, we put out a bunker guide compendium last fall. We supplemented that with with an important guidance as it relates to bunkering for or during the time period of the COVID pandemic. Also, as we mentioned, we have kept abreast of all the very important links to guidance, ICS, Intertanko guidance, Center Disease Control and Prevention, WHO. There are various guidances that are out there. And we have made sure that the most important ones, we've given access to our members and provided the proper links. Some of the issues with regard to case management and prevention, a lot of those are actually in some of these guidance, some of the issues that were already mentioned by Dr. Diskin earlier today. And one of the sites that I'd like to highlight, and we've seen it's very difficult to keep up with all the details. And of course, individual ship owners always, one of the first thing we recommend is that they interface with their local agents as it relates to anything with regard to coming to the port, particularly things related to, or any issues related to crew changes and COVID-19. But Williamson, if you haven't had an opportunity, Williamson COVID-19 port restrictions map is an excellent resource. They update that, I think twice a day, every 12 hours at a minimum. Various agents are updating those on a case-by-case basis, depending upon any changes. And this is for ports worldwide. So we recommend that you actually are able to access that information. And again, the link to that is on our website, or you can just Google that by its name, and you'll find that information available. Just in close from my presentation, we have a plethora of loss prevention materials related to for both safety, security, environmental protection, and cargo protection on our website. We are very adamant about making the vast majority of our materials available on our website, and we welcome you to visit the site. Also, if you have any questions, please, you're always welcome to email me directly. The only reason why I say email, so I make sure I get it and it has to go to the right place and I can manage it correctly. You can always call, but I think email is probably the best way to manage it. Thank you very much for the presentation, and we wish you all free pratique. And that ends my presentation, Brianna. Thank you.
Thank you very much, Bill, for this excellent presentation. So we have several questions and we have some time to answer them. So I'll start with a question to Dr. Diskin. What is your opinion on use of alcohol-based cleaners for surfaces, Dr. Diskin?
Right, alcohol-based cleaners, again, the virus is very sensitive to alcohol. So, I mean, alcohol cleaners would be very effective. The problem is you have a lot of surfaces that are not going to particularly enjoy alcohol being applied to them. So I think you need really a very broad plan for what it is that you're sanitizing, cleaning and sanitizing, and that relates to what the material is that you're actually sanitizing. Obviously, a hard surface that is very durable is fine with alcohol. As I alluded to, there are products out there now that you can apply and give you prolonged antiviral, antibacterial effects, and that enables you to somewhat decrease your utilization of some of the more harsh sanitizing chemicals and maybe reserve them for the really high-touch surfaces.
Thank you very much, Dr. Diskin. And then there is a question to myself and Jack. What is the club's definition of COVID outbreak? Jack, do you want to address?
Well, the COVID outbreak is something that has to be identified as actually related to the COVID-19 virus. So it has to be identified, diagnosed, by either a test, by a test, obviously. So once that's confirmed, that triggers a number of other things.
No, so certainly, and if I may add, definition of COVID outbreak will be tailored narrowly to definition of casualty, and just from memory, definition of casualty per our rules is wherever there is a threat to the life, safety, and health of the passenger or crew. And in a particular COVID case, very much like Jack indicated, that would indicate one or more COVID positive cases. So this would depend on a case-by-case basis, of course. We have more questions. And I want to make a disclaimer, If we can't answer all the questions, we'll certainly address it after the presentation. And one of the questions is this presentation being recorded? Is it available afterwards? Yes, it is. It's available for everyone. We'll distribute the recording and the actual PowerPoint presentations. So another question is, seems to be a lot of tests or false positives when doing groups. We'll get 6 or 10 test results back right away, then wait for 3-4 days for the rest, and even have to retest and struggle with results for the full group. What is the laboratory and tracking process of tests? And now this is a question to Dr. Diskin, I presume.
Right. So the testing has been very difficult because you know, there are a lot of things that could go wrong. It could be a bad swab. Nasopharyngeal requires a certain technique. You have to get an adequate specimen. You know, is that specimen there? Are there problems with the delivery of the specimen to the central lab? Does that central lab, how many tests are they doing? Do they have availability of the reagent to do the testing? In general, a well-collected, well-transported to a quality, what we call clear wave lab, has a very high specificity, which means there are not a lot of false negatives. And again, it's never zero. I think one of the governors, I think of Ohio, had a false positive PCR test. So it's certainly possible. And sometimes it needs to be repeated. And in the hospital, what we do is if we are highly suspicious of a case of COVID and the PCR comes back negative, that's the one instance in which we will use antibodies. You know, again, this is for somebody who's usually already sick. So I think it's a matter of dealing with numbers. You know, you always remember the ones that are inaccurate, the one that's a false negative. Somebody gets tested and then 2 days later they're extremely sick and their test was negative. So all of these tests have false positives and false negatives. And the only way to avoid that is to repeat the test, because with every repetition of the test, you sort of get a logarithmic decrease in the point in the false positives. To my point, we're going to end up, if we can get a test that are cheap enough and quick enough and easy enough that have less accuracy, with the idea that you're just going to go ahead and repeat those tests every day or every 2 days or every 3 days, we may need to accept that paradigm in this transition before vaccines and more effective treatments.
Thank you very much, Dr. Diskin. Another question that we have is, what are the club's criteria for coverage of cleaning of the vessel? And that's actually a very, very good question. And we've had several COVID-related claims, and I'll let my colleague Jack as well. But we are being guided by CDC guidelines, and certainly CDC guidelines provide some clarity to that as to what has to be done on vessels in terms of passenger vessels. Certain groups like CLIA have provided some guidance in terms of other types of vessels. Industry groups like AWO provides a certain guidance. So we have different criteria, but we also work with third-party case managers who specialize in such proceedings as we have in our cases. And there are different ways to do cleaning, and we consult with them, and we certainly approve them, and they widely vary depending on the size and the size of the vessel and the nature of the cleaning. And Dr. Diskin, you're welcome to comment as well, because I know I've personally asked you this question on a claim.
Right. I mean, you know, it's a matter of, again, focused cleaning. You know, so what is a general cleaning? You know, usually the easiest way to clean a vessel and get good coverage as an add above is electrostatic spraying of something, gets on all the surfaces, do that adequately, and then, you know, certainly a focused wearing PPE, cleaning of any areas that were that a crew member under suspect was exposed to, and then you just sort of end up knowing some of the increased risk areas, such as the dining rooms and frequently touched surfaces. So it's just a matter of experience. I mean, on the cruise ships, one of the things we learned that we missed is that in the dining rooms, people would always grab their seats and pull them forward. So we ended up finding high concentrations of norovirus on the undersurface of the seats, and we ended up adding that to a deployment for focused sanitation and cleaning. So I think that without knowing the actual physical layout of a particular vessel, it's hard to make a very specific recommendation. Soft surfaces, hard surfaces, public bathrooms versus private bathrooms, et cetera, et cetera. But every ship sort of needs its own individualized plan and strategy.
Thank you very much, Dr. Diskin. We have a question to Captain Tama. Captain Tama, are you on the line?
I'm sorry, Captain Tama had to depart, but I've stepped in for him. He had to.
No, thank you so much. Thank you for doing this. We have a question for you. Since March, do you find your response to COVID-related issues relatively routine, or are most cases and circumstances fairly unique, requiring regular troubleshooting and innovating responses?
Yeah, it's definitely wasn't routine. Now, we've dealt with infectious disease issues in the past, but the COVID-19 was much greater widespread in the port. So in this particular case, what we had to do was work very closely with the entire supply chain. You know, normally we deal with a vessel, they have an issue, and we deal with the issue of infectious disease, coordinate with CDC. But in this case, it was so widespread that we had to protect the pilots, we had to protect the port facility workers, and so forth, because any compromise in any one of those key stakeholders would create a marine transportation system shutdown. So it was definitely not routine.
Thank you very much. We have another question, and Jack, if you want to cover this, is there an overall resource that has dates to when port restrictions went into play?
I'm sorry, can you repeat that?
Is there a date where port restrictions related to COVID went into play in various
Well, in many places it was different because I know that in certain ports in South America, the borders were closed individually. So there's not one particular date. I know that the United States, stopped accepting passengers, et cetera, from different countries on certain dates. So it's sort of a moving target and different in each jurisdiction.
Thank you. Thank you very much, Jack. And perhaps we have a time for one more question. Relative to HIPAA, we seem to be very freely talking about individuals who have COVID. How is privacy impacted? And I would address this to Dr. Diskin.
Right. So technically, every test that's drawn is or every test that's done is technically the data, the information from that is the property of the individual. So when you go to these large testing centers, you call in and get your results, and then it's up to you if, when, and how you report that is a condition of employment. It's a different issue. I have to demonstrate that I've been tested for tuberculosis, and I have to demonstrate that I've had the flu vaccine to work at the hospital system I work at. So that's a different issue. But at least the initial reporting of the test should go right to the individual who was tested. And then everything sort of follows from that. So if you can't get on the cruise ship without disclosing your test result, they don't have to let you on without knowing the status of your test result, but I'll leave that layer to you as the attorney. But as far as the initial reporting of the test result, under HIPAA, that should clearly, at least initially, go back directly to the person who was tested.
Thank you, and I'm glad you're saying an attorney. So from a legal perspective, if we have an active lawsuit or a complaint filed, certainly the appointed lawyers can serve requests for HIPAA authorizations where all the medical records are collected in due course in discovery. So that's not an issue anymore. So I wanted to clarify that. And we from the club haven't faced this scenario yet, but we might. With that, I want to thank everyone for really their fantastic and extraordinary participants. Thank you for all our audience, for the wonderful questions. Thank you again to our esteemed speakers for the excellent presentations. I would like to remind everyone that we have a cybersecurity session, part 2 of our seminar. And Bill, if you'd like to briefly say a few words about that. I'll
We
let
hope
you.
you've registered and you're welcome to.
Absolutely. And it's at 1:30, I believe, right?
1 o'clock.
1 o'clock,
1
apologies,
o'clock.
it's 1 o'clock today. I'll certainly be participating. Again, all the presentations and the recordings of this presentation will be sent to everyone end of the day tomorrow, at the latest Thursday. And we are happy to address further questions in writing. You can access us, our contact information is in our website. We are 24/7 for you. Thank you and have a great day.
Thanks, everyone. Thanks for all the participants, and we wish you safety and wear your masks
Yes, wear your mask and get your flu vaccine.
and get your flu vaccine. Listen to the doctor.
That's right. Thanks, everybody.
Thank you.
Take care.
Thank you all. Appreciate it.
Thank you.